Every day, millions of people step into the shower with a sense of routine and comfort. It is a ritual so deeply embedded in daily life that most hardly give it a second thought. The warm water, the steam, the refreshing feeling of cleanliness, these are things people often associate with health, relaxation, and renewal. Yet, what if something as ordinary as the way you shower, the timing of it, or even the temperature of the water could set into motion a dangerous chain of events that silently endangers your brain while you sleep? It might sound unbelievable, almost impossible, that something so simple and innocent could carry such hidden risks. But the truth is that there are subtle habits linked to the shower routine that can put incredible strain on your cardiovascular and neurological systems. And when the body is most vulnerable, during sleep, that strain can manifest as something life-altering: a stroke. The human brain is one of the most complex organs in the universe, relying on a constant and carefully balanced supply of blood and oxygen to function. Tiny changes in blood pressure, vessel health, or circulation patterns can have enormous consequences. A stroke occurs when that blood flow is interrupted, either by a blockage or by a rupture. It is not always sudden and random. Sometimes it is the result of years of lifestyle choices that build risk quietly, and sometimes it is triggered by a seemingly harmless daily activity that pushes the body beyond its fragile threshold. Among those triggers, certain shower habits stand out with surprising impact. One of the most overlooked factors is water temperature. Many people love ending their day with a steaming hot shower, believing it relaxes the muscles, soothes the nerves, and prepares the body for restful sleep. What they may not realize is that extreme heat from water causes blood vessels near the skin to dilate rapidly. This widening effect makes the heart work harder to maintain stable blood pressure, drawing blood away from the brain temporarily. For a healthy young individual, this adjustment might pass without noticeable effect. But in someone with high blood pressure, arterial stiffness, or underlying vascular conditions, that sudden fluctuation can increase the risk of clots shifting, vessels weakening, or microbleeds forming. And while they sleep afterward, when blood pressure naturally dips and brain activity cycles through different stages, the fragile balance can tip into catastrophe. On the opposite end, some embrace ice-cold showers as a way to energize the body or toughen the immune system. While cold exposure has benefits in controlled doses, it too places an acute demand on the nervous and circulatory systems. A sudden blast of cold water activates the body's fight-or-flight response, releasing adrenaline, constricting blood vessels, and spiking blood pressure. For individuals with undiagnosed aneurysms or plaques lining the arteries, this sudden surge can be enough to rupture a vessel or dislodge a clot. It is not the cold water alone, but the shock and the body's reaction to it that poses danger. And when such stress is added right before bed, the risk of nocturnal complications rises. Beyond temperature, timing itself plays a crucial role. Showering late at night has become more common as people juggle hectic schedules, long work hours, and stress-filled days. While it may feel like a cleansing ritual before sleep, this practice can disrupt the body's natural rhythms. When hot water raises core body temperature in the evening, it can delay the natural cooling that signals the brain it is time to rest. As sleep becomes restless or fragmented, blood pressure patterns are affected, reducing the restorative cycles that protect vascular health. Moreover, lying down soon after a very hot or very cold shower can intensify fluctuations in blood circulation, creating an environment where strokes are more likely to occur. Another hidden danger lies in posture and movement within the shower. Many individuals, particularly older adults, close their eyes under the spray, tilt their heads back, and let the water cascade over their scalp. While it seems harmless, this position can sometimes restrict blood flow through certain arteries in the neck, especially if there are already blockages or stiffness. Temporary dizziness or lightheadedness is often dismissed as nothing serious, but in reality, it is a warning sign that circulation is being compromised. Ignoring such signals increases the risk of lasting neurological damage, particularly during sleep when the body can no longer compensate as effectively. The use of bathroom products may also contribute indirectly. Inhaling strong vapors from certain shampoos or soaps, combined with the steam of a hot shower, can irritate the respiratory system and lower oxygen intake subtly. When less oxygen reaches the blood, the brain is put under additional strain, increasing the risk of ischemic events overnight. Although this factor may seem minor compared to water temperature or timing, the cumulative effect of multiple stressors cannot be ignored. What makes these risks particularly insidious is that they often go unnoticed until it is too late. People may attribute mild headaches, sudden fatigue, or slight dizziness after showering to stress, dehydration, or lack of sleep, when in reality, these are small warnings from the body. By the time a stroke strikes during the night, it may already be the result of patterns repeated for weeks, months, or even years. Consider, too, the vulnerability of older adults. With aging comes a natural decline in vascular flexibility, reduced tolerance for temperature fluctuations, and a higher likelihood of undiagnosed circulatory problems. For them, the nightly hot shower or sudden icy rinse can carry risks far greater than anticipated. Yet cultural habits, comfort, and long-standing routines make these practices difficult to question or change. Families may not realize the potential danger until an emergency occurs. The science behind these warnings is supported by the way the brain and cardiovascular system interact. Blood vessels are lined with delicate endothelial cells that respond to heat, cold, and pressure. Sudden changes force these cells to release chemical signals that either dilate or constrict vessels. When this happens repeatedly or at extreme levels, micro-injuries accumulate. These small damages may not be felt day to day, but they create weak points in the vascular system. During sleep, when blood pressure naturally dips and cerebral perfusion decreases, those weak points are at greater risk of failing. A vessel rupture or clot during the night is particularly dangerous because it may go unnoticed for hours, delaying treatment and worsening outcomes. Preventing such risks does not require eliminating showers from life, of course. Rather, it demands awareness and moderation, choosing lukewarm water instead of extreme temperatures, avoiding very late night showers, and paying attention to the body's signals can all reduce the hidden dangers. For those with known cardiovascular or neurological conditions, making even small adjustments can be life-saving. It is about respecting the body's limits and recognizing that even daily routines carry consequences for long-term health. When we look at the broader picture, this issue reflects a larger truth. Health is not only shaped by the big decisions, what we eat, how much we exercise, whether we smoke or drink, but also by the small, repeated habits that we take for granted. A shower seems too ordinary to matter in the grand scheme of brain health, yet it does. By underestimating the impact of temperature, timing, and circulation, people leave themselves vulnerable to one of the most devastating medical events possible. A stroke can steal independence, memory, mobility, and even life itself. And if avoiding such a fate requires nothing more than slight changes to a shower routine, then awareness becomes not just important but essential. Night after night, countless people will go to bed unaware that the decisions they made in the bathroom just minutes earlier could influence whether their brain wakes up healthy or damaged. It is a silent risk, one that hides behind comfort and routine. But by shedding light on it, by understanding the biological realities behind those seemingly small choices, people can take back control. Health is not about living in fear, but about living with knowledge. And knowledge here may be the difference between waking up refreshed and never waking up at all. Small, unnoticed symptoms after showering may be early warning signs of stroke. When most people step out of the shower, they expect to feel refreshed, relaxed, and renewed. But not everyone pays close attention to the subtle changes the body communicates in those moments. A fleeting dizziness, a light headache, a numb fingertip, a sense of imbalance that disappears in seconds, or even a momentary blur in vision may not seem alarming, especially when they fade quickly. Many dismiss them as trivial, perhaps caused by fatigue, stress, or dehydration, but in reality, these small signals can be the body's way of whispering that something more dangerous is happening beneath the surface. The problem with strokes is that they rarely appear out of nowhere. In many cases, the body gives hints, subtle warnings that something is not right in the delicate balance of blood flow to the brain. After a shower, when circulation shifts rapidly due to changes in water temperature, body posture, and steam exposure, those warnings may become more pronounced. Yet people often overlook them. Consider the moment when someone steps into a hot shower. The body reacts immediately by dilating blood vessels near the skin to release heat, a process known as vasodilation. This sudden expansion can lower blood pressure in some parts of the body while increasing demand in others. The brain, which relies on a steady, regulated flow of oxygen-rich blood, may experience temporary fluctuations. If someone notices that their vision blurs when tilting the head back under hot water, or if they feel momentarily lightheaded while bending down to pick up soap, These are not random occurrences. They can be signs that blood flow is not reaching the brain as efficiently as it should. While the body may quickly compensate, the fact that the symptom appeared in the first place suggests vulnerability. Each minor episode is like a warning flare, but because it passes quickly, many people never connect it to something as serious as the risk of stroke. Cold showers or sudden blasts of icy water create the opposite effect, constricting blood vessels in a process called vasoconstriction. This raises blood pressure sharply, activating the sympathetic nervous system and forcing the heart to pump harder. For someone with healthy arteries, this stress may be tolerable, but in individuals with plaques, weak vessels, or hidden aneurysms, even a brief spike can cause micro-damage. The body sometimes reveals this in small ways: a sudden tingling in the arm, a quick rush of pain in the temple, or an unusual ringing in the ears. These fleeting sensations, experienced in the aftermath of a cold shower, should not be brushed aside. They may represent small ischemic events, transient interruptions of blood flow that heal on their own, but leave the brain at greater risk for a larger event later. Another overlooked symptom after showering is mild numbness or tingling in extremities. Many attribute it to sitting awkwardly, standing too long, or even the effects of warm water relaxing the nerves. But in certain cases, this numbness could reflect reduced blood flow or a brief clot-blocking circulation. When it occurs repeatedly after showers, it becomes a pattern worth noticing. The nerves and blood vessels are closely interconnected, and what may appear as harmless pins and needles could actually be the nervous system reacting to compromised circulation. Headaches after showering also deserve attention. Some people walk out of the bathroom feeling as though a tight band has wrapped around their skull, or they experience a sudden throbbing sensation in the temples. This might be explained away as sinus pressure from steam, dehydration, or stress, but in some cases it may be a small-scale vascular event. The brain's blood vessels are sensitive to temperature changes and shifts in pressure. A headache that emerges only after hot showers or only after cold showers is not a random coincidence. It is a pattern of vascular reactivity that points toward increased stroke risk. Balance issues are another subtle but important warning. If someone notices they feel unsteady stepping out of the shower, perhaps needing to grab the wall or steady themselves more than usual, this could indicate that blood flow to the cerebellum, the part of the brain that manages coordination, is being disrupted. This symptom may appear fleeting, disappearing once the person has dried off and moved on with their day, but ignoring it means overlooking a vital clue. The cerebellum does not malfunction randomly. Even short-lived episodes of imbalance deserve careful observation, especially if they only occur after exposure to shower routines. Vision disturbances also fall into this category of unnoticed warnings. A person may find that their vision momentarily dims, as if a shadow passed across their eyes, or they may see double lines while drying their hair in the mirror. These symptoms often fade quickly, leaving no trace, but they are not meaningless. Such disturbances can signal transient ischemic attacks, often referred to as mini-strokes. Though they resolve within minutes, they serve as direct evidence that blood flow to the brain is being interrupted. To ignore them is to miss a clear sign that the brain's vascular system is in jeopardy. Fatigue is another overlooked clue. Instead of feeling energized after a shower, some individuals feel drained, as though their body has been through a physical ordeal. While this may be blamed on poor sleep or general exhaustion, it can also be the result of the cardiovascular system working overtime to stabilize circulation during and after the shower. If the brain is not receiving consistent oxygen supply, fatigue is one of the first signs to appear. When linked specifically to post-shower moments, it warrants deeper reflection. Shortness of breath in the bathroom, especially after hot showers filled with steam, may also signal more than poor air circulation. The combination of heat, humidity, and restricted oxygen intake can stress the cardiovascular system, forcing it into a state where the brain receives less oxygen than it requires. If someone notices they feel unusually winded after showering, or if they must sit down to recover, this is not a trivial matter. It indicates that the brain and heart are struggling under conditions that would normally be tolerated by healthier systems. Even mood changes can provide subtle warnings. Some individuals feel anxious or irritable after showering, emotions they cannot explain. This may be linked to the body's hormonal and neurological response to sudden vascular changes. The brain is extremely sensitive to shifts in circulation, and mood disturbances can be its way of signaling distress. Although few would associate shower-induced anxiety with stroke risk, the connection lies in the body's response to instability in blood flow. The key to understanding all these subtle symptoms is recognizing patterns. One isolated episode of dizziness or one minor headache may not indicate serious danger. But when these issues appear repeatedly, specifically after showering, they form a pattern of vulnerability. The brain and circulatory system are not silent. They give warnings in the form of small, transient discomforts. The challenge is that people tend to dismiss these signals, rationalizing them with simple explanations that make sense in the moment. The tragedy is that by ignoring these signs, many individuals allow underlying problems to progress unchecked until a stroke occurs, often suddenly and devastatingly. Another reason these warnings are so often overlooked is that modern life encourages people to push past discomfort. Fatigue is blamed on busy schedules, dizziness on skipped meals, headaches on stress, and vision disturbances on too much screen time. While these explanations can sometimes be true, they should not erase the possibility that the body is signaling a serious risk. The context of these symptoms, appearing specifically after a shower, should raise attention. This environment of fluctuating temperature, humidity, and blood circulation makes it a prime setting for hidden vulnerabilities to reveal themselves. It is also important to note that not all early warning signs of stroke appear dramatic. Hollywood depictions of strokes often show someone collapsing instantly, unable to speak or move. In reality, many strokes begin with much subtler indicators. A minor drooping of the mouth that resolves in minutes, a tingling sensation in the hand, or confusion that clears quickly are all examples of transient symptoms that carry enormous significance. When these align with moments after showering, they reveal a connection between a daily habit and a life-threatening risk. The body is wise in its ability to send signals, but it relies on awareness to interpret them. Small symptoms are not inconveniences to be brushed aside. They are the earliest opportunity to intervene before a stroke takes hold. Medical studies repeatedly show that individuals who report transient ischemic attacks or other minor neurological